This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
About 1 in 9 adults has some kind of chronic kidney disease, and it's something everybody should be aware of. How can people know about their own kidney health?
It would be a great idea if they get their blood pressure checked and if they get a regular chemistry panel done when they have their physical, and if their creatinine level's good and their blood pressure's good, and if they don't have any protein in their urine, probably their kidneys are okay. But you can have kidney disease without symptoms, so it's good to have that checked periodically.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that person, that case, is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. we can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head-on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school, and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000. Just wanted to say, first of all, that the Patient Advocate Foundation has been a ongoing partner with the African American Health Matters for going on 2 years now. And they have a very valuable service, not only for all Americans, but for African Americans as well. So we're very, very happy to have Erin Moaratty with us today. Erin is Chief of External Communications for the Patient Advocate Foundation, and she's responsible for coordinating projects, including media inquiries and policy legislative requests. She monitors trends on healthcare-related issue and provides information on emerging trends to the PAF leadership team. She is a senior editor for the PAF Publications Committee and has co-authored several publications which have been produced and copyrighted by the foundation. She is an integral part of the patient services training program, and needless to say, Ed and I are extremely happy to have you with us today. So we're just going to be talking as if we're sitting in our living room. So we're going to kick off with some of our questions here. The first is, explain to our audience, Erin, what is the mission of Patient Advocate Foundation?
Okay, well, Patient Advocate Foundation was established on the principle of eliminating patient obstacles to access quality health care. And really what that means is we help patients safeguard through effective mediation, assuring access to prescribed health care, maintenance of their employment, and preservation of their financial stability relative to the diagnosis of a life-threatening or debilitating disease. It's really just a collaboration of all the aspects of which someone might face on a diagnosis of a severity level.
Mm-hmm. Okay, Erin, we know you guys have been around for quite a while, but how many patients would you say you've helped over the years?
Well, we last year in 2010, we assisted 82,963 patients, which is actually almost a 50% increase over 2009. But since our inception in 1996, we've provided assistance to more than 650,000 patients and really touched millions more of Americans through our PAF website, online chats, and outreach events.
That's great. That's great.
And you guys have something called case management. What services does PAF case management provide?
Our case managers specialize in mediation, negotiation, and education around problems such as access to medical devices, surgical procedures or medications, clinical trials, complex therapeutic protocols. Maybe they need some assistance with copay, locating copay assistance or procurement of medical write-offs for treatment services, appeal assistance or negotiation with transportation and lodging for someone who might need to travel for treatment. Mm-hmm. We also help patients who are looking to navigate the public and private health insurance coverage through such COBRA, Medicaid, Medicare, and some of the high-risk insurance pools. And right now with healthcare reform, we have the pre-existing insurance health plans. We also provide assistance in identifying resources around cost of living, including rental, mortgage, eviction or foreclosure problems, food, nutritional needs, utility, those types of things. And of course, what's important is, if someone is diagnosed with an illness that might prolong treatment or may require them not to be able to return to work, we always help them go through the enrollment process of Social Security disability, supplemental security, long-term or short-term they might have through work, as well as look at all of the federal
Yes, and speaking of the uninsured, what is an uninsured appeal? What does that consist of?
Well, an uninsured patient typically would be probably appealing maybe a source like Medicaid, or maybe they are trying to gain insurance and maybe they're not having an issue with that. We can also apply for programs that may be available through their local hospitals, such as charity care, talk to the individuals that they're seeking care from to see if we can secure donated medications or reduction in rates. An insurance appeal tends to be more relative to someone who has health insurance and the insurance does not feel that the service or the requested therapy is within the language, or they often will deny them for multiple different reasons. It could be that they feel it's not medically necessary, or they don't have enough evidence to support, the request. And so those are a little more in depth because we need to research the circumstances why it's denied, make a determination through medical records and evidence support through journals and such to make those arguments for overturning them.
Mm-hmm. So let's just say a case study might be a person who has an illness, say cancer or whatever, and they're underinsured or have no insurance at all. They really can't afford the medical treatment. Is this the type of person that you guys will assist?
Absolutely.
Okay.
We help patients regardless of their insurance status.
Okay.
So even those that have insurance, like you mentioned, can be classified into the underinsured category. Maybe they have a very limited plan that caps out at, maybe $5,000 annually, or maybe they have a prescription need and they have no prescription coverage. Those patients tend to fall in that underinsured category because they don't have adequate coverage and they simply can't afford their out-of-pocket costs associated to the treatment they need. And really can start going into more of a uninsured status because they're pretty much left in the same scenario as someone who had no coverage at all. And so that's our specialty. That's what we do. We look at all the avenues that exist. If there's an insurance option, we do try to see if that's one of the options that present itself. But if not, we look at all of the different programs and understand all the different avenues that we can search because everybody's circumstance is very unique and individual to themselves, right from income, asset, family size, diagnosis, and all of those things play a factor when you're trying to find sources to help.
Well, Erin, what happens when a patient or family member contacts PAF and they don't have any money at all?
Well, that also, with our case management services, we actually have that is not a requirement as well to get assistance from the foundation. That is for, that's what we try to do is look at the resources that exist. Now, if their circumstance has changed and maybe that's why they have no income, maybe they've become ill and they were the breadwinner of the family, and so we may have to look at what may be available to them that may not already know. Is there a disability plan? Should they be looking at disability through the Social Security Administration? Do they qualify for unemployment? We have to really kind of ask those kind of questions to know how to best pursue that individual's needs. Obviously, our main focus is ensuring the access that they need, as well as them, and we always look at the children that are in the family as well and ensure that they have services as well. We do have 21 different programs that are offered through the foundation. One of them is our co-pay relief program, and that is really specific to those who have health insurance coverage that pays a partial of their pharmaceutical needs, and it does have 19 different categories in which you can qualify, and that is a financially based program based on insurance status. But that's separate to our case management services, which really is just a handheld service to patients that are trying to just navigate the system.
All right. Now, you mentioned programs. What programs and our partnerships does PAF have?
Well, we have partnerships with the Lance Armstrong Foundation. We also have partnerships with the American Cancer Society and Susan G. Komen. We also have some programs that we initiated to really outreach to the community. So we have a National African American Outreach Program and a National Hispanic Latino Outreach Program. And what we've done is just designed it to educate specifically around the diseases which are high risk for the populations that we are serving, and by attending or speaking at local and national meetings and going into communities that we feel that through our research has been beneficial. We And at that point, we had about 14% of the patients that called Foundation were actually African American. And in 2010, we actually saw an increase to about 17%.
Great.
And we feel that the outreach has been effective.
That's wonderful. That's really, really good.
So, Erin, how does PAF assist with unemployment rights for disabled people?
Well, what we try to determine is what state laws, federal laws, what programs are out there that they fall within. So we look at everything from Family Medical Leave, we look at COBRA, we look at the American with Disabilities Act. We have to look at all of those angles to determine, that they understand what benefits protect them. And we also have a network of attorneys that we can rely on should we find that a situation is far beyond a case management exposure. We have to utilize them very often. We do find that our negotiation between the employer and ourselves is effective, but if we have to utilize that method, we can certainly get guidance and counsel from them. Your employer, depending on how large it is required to maintain your job while you're out attending to your illness. And then, of course, if you were to transition into a disability status, there are some circumstances that lie with that. Like I said, very unique to the circumstances. We've published a lot of publications around certain topics, and one actually is around, it's called First My Illness, Now My Job. Great under outliner to some of the things that you may experience, especially if you're newly diagnosed.
Well, you hit up on a lot of things. It's really interesting. In this country, we're going through a lot of transition now in our health system, in our health care system, with our health care provision for Americans, and the health care bill that Congress and the political system are trying to initiate. It's a broken system right now. So how do we fix it? Erin?
How do we fix it? Well, at Patient Advocate Foundation, we truly believe in addressing daily concerns brought to us by our patients one at a time. And what we do with that is we actually take the data that we're able to capture, all of the scenarios that they're facing, all the issues that they're coming across, and we actually compile that and are able to really provide our National Patient Advocate Foundation, which is the policy arm of PAF that was also founded at the very same time, so that we can really give the statistics that hopefully will move policy and make some change. And a good example I could give you is that under the Healthcare and Affordable Care Act, you know that pre-existing clauses are being eliminated for children, and we're supposed to be eliminating for adults in 2014. There's some caps on out-of-pocket spending and elimination of lifetime caps. All of those things we have been trending for years and have been able to supply that evidence to those on the Hill. And so I feel that while we can only fix one thing at a time, we hope that the evidence and that data can really push to change positive.
Yeah, you had mentioned the health care bill. How is the health care bill as it stands affecting how you guys are working?
Well, what we've noticed that there's some safety nets that are in place that have been very beneficial to some of the consumers that call us. One of the aspects of the bill that we did find that has been a real positive addition is the dependent children being allowed to remain on their parents' health insurance up to the age of 26. That has been a wonderful opportunity for some that were transitioning into college or maybe getting into their part-time jobs right out of school and not necessarily having the income or the benefits available to them. So we created a safety net with that, and that we feel very confident that was a good choice. We also know that they've listed the barrier for imposing lifetime caps, which with any chronic illness, you know that you can blow through those very, very quickly, even at $1 million.
Oh, yeah.
Have anything significant, you find yourself truly uninsured with access issues. Some of the things that we know that they're replacing are the pre-existing health insurance plans. We do know that those are available to every patient that has high-risk illnesses but have no health insurance. The challenge with them still today is the cost associated, even though they did make some changes and try to reduce those costs. It's still problematic for people people that are very ill and not able to maintain a source of income. So, we've taken the positives and trying to look at how we can, provide the data to support, some of the, we can make some changes. But, overall, we're going in a stepping system.
Yeah, that's right.
Yeah.
Mm-hmm.
Having preventative care, no co-pay or deductible is also great. We're encouraging people to kind of step outside and get those hopefully preventative measures so that we don't get your diagnosis too late.
Absolutely. You're absolutely right.
And Erin, probably one of the most important questions is, how can our audience actually reach PAF?
Wonderful question. We are available at 1-800-532-5274, Monday through Friday from 8 to 8 Eastern Standard Time. We also have a website, which is www.patientadvocate.org. That's available 24/7. We also have an online chat that can be reached during business hours, as well as an email status, but our staff is here to provide some either education, guidance, or lead you right through processes that you're facing. We do encourage you to look at our website, lots of information, applications that you might find beneficial as well.
That's great. The number again is 1-800-532-5274, and that's the Patient Advocate Foundation. Very, very good, Erin. This has been a wonderful time. I would like for you to just kind of give us some closing, anything that you feel our audience should know in addition to the much information that you've already given. Anything closing statements?
Well, PAF really strives to provide education and guidance to the patients that reach out to us, not only those that we serve, but for their family and friends. And through advocacy, we feel that, providing materials and direction is so very important. And so we've actually established a couple websites that you may feel of benefit. We have our Insure Us Today, .org, which is a resource for when you want to understand how healthcare reform is affect you. It has an online blog. It actually has a toll-free number that can direct you to our staff. We also have a resource called a National Underinsured Resource Directory, which we've done is a collaboration of resources that exist and help you by answering some questions, just verify, and get you to the resources that may benefit you the best and give you resources to try to alleviate some of those out-of-pocket costs you might be facing. So that's something that we continuously do. Keep going back to our site, and you'll continue to find more information. But really, I strongly encourage anybody that may be having a challenge, whether it's a denial of an insurance claim, having no coverage at all, not understanding why a bill may have come to them despite having it appear to be paid through the explanation of benefit, disability, or financial concern relative to their diagnosis, to really call the foundation. We can provide you a lot of information, and you may only need a helping hand right now, or you might need us in the future, but feel free to call us if you ever have any concerns or challenges.
That's great. Now, one more time, give us your 800 number and your website.
It is 1-800-532-5274 and www.patientadvocate.org.
Thank you so much, Erin. This has just been wonderful. And again, thank you for continuing to be a part of African American Health Matters. And we will be hearing more from Patient Advocate Foundation, more from Erin Moaratty, and everybody just keep in touch with us here on Cyberstation USA.
Trying to get my ladies back on track. Drop that weight before you have a heart attack. Oh, just like that. Okay, now let's go to work. Shoes, gym, short shirts. Drop that weight just like a hurt. Okay, let's drop that pound cake. Don't look at me with a frown face. You know you need to get it right. Oh, but my cellulite, let's get it right. I got that word. Drop it down, make it work. Pick it up from the dirt. 'Cause I don't wanna see you hurt. just gotta let you know, 'cause I wanna see you live. I don't wanna see you dead. All my ladies, when we ready, let's get your hearts right. Let's go. And move to the left, move to the right, turn it around, jump up and down. Move to the left, and move to the right, turn it around, jump up and down. Get low, get low, get low, get low, get low, get low. Bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up. Okay, ladies, here we go again. Tell me be your doctor, not your friend. Put cigarettes down, I recommend. If you die too soon, it will be a sin. Now wait, freeze, don't eat that. Fatty foods cause heart attack. Arteries hard like dental plaque. And when you die, you can't come back. Go red, rise, take control. Save your mind, body, and soul. It's never too late and you're never too old. Cross that finish line, take and go. Time for you to exercise. Work your booty, hips, and thighs. We hope that you recognize we're red. That's right, we're saving lives. Yeah. Let's go. I don't wanna keep it in. I just gotta let you know, 'cause I wanna see you live. I don't wanna see you down. All my ladies, when we ready, let's get your hearts right. Let's go. And move to the left, move to the right, turn it around, jump up and down. Move to the left, and move to the right, turn it around, jump up and down. Get low, get low, get low, get low, get low, get low, get low. Bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up, now bring it up, bring it up.
Did you know that African Americans have one of the highest rates of asthma? Asthma is a lung disease that makes breathing difficult for both young and old. Although there's no cure for asthma, it can be managed and treated so you or your loved ones can live a normal, healthy life. You can be as active as you want to be. The American Lung Association can help. Learn more about asthma and keep it under control by visiting www.lungusa.org or call us at 1-800-LUNG-USA.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.